Workday Adaptive Planning understands that not all healthcare organizations plan and budget the same. For instance, a physician practice might utilize visits, RVUs, to help predict what charges, payments, revenue, and salaries of the physicians. Utilizing multidimensional planning, Workday Adaptive Planning allows our customers to drill down into the level of detail that makes sense for them. For instance, using these dimensions up on the top, I'm able to drill down into a given location. I can also drill into a specific provider at that location. I can view any of these at the aggregate or the detailed level. This empowers our physician practice organizations to forecast at the level of granularity that makes the most sense.